I now have the honor of introducing Dr. Benard Dreyer, who will discuss the new report from the National Academy of Sciences, A Roadmap to Reducing Child Poverty. Dr. Dreyer, a general and developmental behavioral pediatrician, served as a member of the committee that authored this report. He has spent his professional life serving poor children and families. For over 40 years, he has led a primary care program at Bellevue Hospital in New York, including co-located mental health and oral health services and clinics in homeless shelters. He is a past president of the Academy and now serves as the AAP's medical director for policies. As AAP president, he led the AAP's strategic priority on poverty and child health. Dr. Dreyer was president of the Academic Pediatric Association and founded the APA Task Force on Childhood Poverty. Please welcome Dr. Benard Dreyer.
Thank you. Okay, so there are amazingly many hardy people still here. What are you doing here? I expected to see like 4 people. I asked them to run around the room and make believe there were more people. By the way, Dr. Elizabeth Mead's talk was really fabulous. I know you appreciated it, and I think it's really a setup for what I'm going to talk about, because poverty intersects with all the issues that she was asking you to advocate for. So, I have nothing to disclose. I'm not going to just waste my time reading these objectives, but I'll just perform them. So poverty, this looks at the official poverty measure from 1959 to 2018. The blue line at the top is kids. They're the poorest group in our society, starting in the mid-70s. You can see that poverty goes up and down with the economic cycles, but kids somehow are still on the top. That wasn't always the case. You can see earlier, older adults were the poorest, but the government took care of them. Expanded Social Security, started Medicaid, and a number of other issues that made them now the least poor of the age groups. In 2013, the AAP adopted poverty and child health as one of its strategic agendas for children. And in 2016, we published a policy on poverty and child health in the United States. And both of those were very impactful. The policy asked pediatricians to screen for social determinants and basic needs, also to support programs that improved early childhood and brain development, but also asked the government to reduce child poverty. And that's what I'm going to be talking about today. So the government took the hint, and this is the roadmap to reducing child poverty that was published last February by the National Academy of Sciences. The members of the committee were interdisciplinary. There were people from public policy, from economics, social scientists, child welfare, medicine, and developmental psychology. This is the list. These are really stars in this. I'm not including myself in that group, but I was the token pediatrician on the group. And it was a pleasure to work with so many talented economists, especially, and social scientists. So the Congress actually amazingly paid for this, gave $1.25 million, and asked the National Academies to provide a nonpartisan, evidence-based report that reviewed the research on linkages between child poverty and child well-being, provide an analysis of the major programs that exist now that reduce poverty, and then provide some suggestions to reduce child poverty in half by 10 years. So I'll start by a quick review of the research. There are, slews of studies that look at correlational associations between poverty and a host of really adverse childhood experiences and outcomes and adult outcomes. I'll show you one or two slides. But what we wanted to prove when we reviewed the literature was that income itself made a big difference. Because when you think about it, poor people have other problems. They have low education, et cetera. They may be single parents. Maybe it's not the poverty, maybe it's those characteristics. So we needed to first see if we could find evidence that, in fact, reducing child poverty would be a good thing. And so this is sort of how poverty works. Basically, for early childhood, this is it goes through an investment pathway or a stress pathway. So if parents are poor, they can't provide toys and books and experiences and good quality daycare for their children. And if they're stressed out, it interferes with their ability to really provide nurturing parenting. This is one of a number of studies that looks at the brains of poor versus non-poor kids. And you can see that this looks at total gray matter. It's by Hansen from 2013. And by 3 years of age, the total gray matter is in high SES kids is significantly larger than in low SES kids. And there are a number of studies that look at these changes. Remember, these are average changes. So we're not saying every kid is doomed from the start, but on average, poor kids have less volume, less surface area, et cetera, in their brains. This looks like long-term adult outcomes from living in poverty in early childhood, in the first years of life. This is from Greg Duncan and his colleagues. And you can see that the kids growing up in poverty early in life are in blue. Those that are less poor, 2 times the poverty level or more, are in orange. And adult earnings are quite different. Use of food stamps is greater in the poor kids, percent in poor health, and for women, percent with non-marital births. So poverty has long-lasting impacts on the child and the adult that they will become. So what we did then is look to see if we could find studies that could prove cause. Now, you can't design a randomized controlled trial and say, I'm going to assign you into growing up in a poor home and you to grow up in a wealthy home. But there are a number of natural experiments or opportunities to study this. And I'm not going to really go through all of these, but just mention that these are the kinds of areas where we were able to find causal studies. For example, the Earned Income Tax Credit was rolled out from the late 80s through the 90s, slowly. So it provided an opportunity to see which kids got more of that money and which kids got less, and then compare their outcomes. Likewise, welfare to work programs. There were many welfare to work true experiments before welfare reform in 1996. And those, again, gave us an opportunity to see which of those programs actually increased parent income and which did not, and what happened to the kids. SSI, likewise, and tribal government supplemental income. There's some famous studies that from North Carolina where both non-tribal and tribal families were in an epidemiological study, and in the middle of the study, a gambling casino opened up on the tribal lands, and each tribal family got $9,000 a year, and we could see the difference that that amount of money made for those kids. This is just looking a little deeper at the Earned Income Tax Credit study. So the first slide here, the credit, as you see, as the credit increases on the x-axis, the average test score in math and reading increases as well. And those increased test scores on the left, as you can see, are very closely related to going to college and graduating from college by 20. And on the right, you can see that they're also associated with increased income and earnings. So in total, the weight of the causal evidence indicates that poverty itself causes negative child harm outcomes, meaning income poverty, not just the other aspects of it. And it's especially when it occurs in early childhood or persists through a large portion of childhood. And many programs that alleviate poverty, either directly like the Earned Income Tax Credit or indirectly like SNAP, have been shown to improve child well-being. In summary, income does matter. It really affects the resources, the parenting, the neighborhood, and all aspects of the child's life. We next were tasked with looking at present programs and seeing how they worked. I'm going to very briefly just point out that if you look at, this is the poverty level, and in the red is how much each of these programs would increase poverty if it weren't there. You can see the Earned Income Tax Credit, for example. Child poverty would increase by almost 6% if we did away with it. And if you look at the very top, without all these programs, child poverty rates would be 9%, 8.7%, almost 9% higher. So our present programs do work. They just don't work enough. Finally, we were asked to provide policy and program recommendations for reducing the number of children living in poverty in the US by half within 10 years. So we were asked to use something called the Supplemental Poverty Measure as opposed to the official poverty measure. And there are a number of differences, but I'm going to just go down to the last one here because the key difference is that the Supplemental Poverty Measure is not just gross income before tax of your cash income, but includes non-cash benefits such as food stamps and tax credits such as Earned Income Tax Credit. So we could model the impact of changing those programs using the Supplemental Poverty Measure. The other thing that we talked about when we started this was, is 50% reduction in child poverty achievable? And here you can see that, as you probably know, the UK cut its child poverty rate in half from 2001 to 2008. It's backtracked a bit after that. And Canada has now, since 2016, have a child benefit of almost $6,000 a year for each child. That's on the way to cutting poverty in half pretty quickly. And in fact, if you look at the Supplemental Poverty Measure, which accounts for all the programs the government does give program, we have in fact cut child poverty in half from the early 60s to the present day. So we looked at 20 individual policy and program options and 4 packages of those programs. I'm going to focus just a little briefly on this. We had a number of policy options that were tied to work. We all value work. I value work. I want everybody to work. But in fact, many people in our Congress value work more than anything. And so we wanted to make sure we advantaged programs that encouraged work. And you can see the Earned Income Tax Credit, child care subsidy so parents can go to work, raising the minimum wage, et cetera. We also looked at modifying existing provisions relating to immigrants. As you may know, in 1996, with welfare reform, recent immigrants were denied many federal benefits for the first 5 years that they're here. We looked at expanding existing programs like food stamps, SNAP, or housing choice vouchers. Right now, only about a quarter of the families that could use a housing voucher actually can get a housing voucher. It's a limited number. So, for example, we looked at expanding that to being able to give 70% of the families housing vouchers. And finally, we looked at some new policies from other countries. Very specifically, we looked at changing the child tax credit into a universal child allowance, which would be modeled on the Canadian child benefit. So we looked at we basically got a moderate and powerful version of each of these 10 programs. You can see that individually, the ones that help the most are earned income tax credit, food stamps, housing vouchers, and child allowances. But none of these by themselves would do what the Congress wanted us to look at, which is reduce child poverty in half. And so we put together packages of these programs, and we decided to look at 4 different levels. So the first level are work-oriented programs only. If you value work, as many, especially in the Republican Party, do, then these programs would help poor children but encourage work, earned income tax credit, child care tax credit increases, increasing the minimum wage, et cetera. And basically, if we just did that, we would drop child poverty by almost 20%. And we, just to point out, we looked at regular, full 100% child poverty, but also deep poverty to make sure that those kids at the very bottom were also being helped. And in fact, the work-oriented program would increase the number of workers in these families by 1 million. And it costs a mere $8.7 billion, which is not a joke. It is a mere $8.7 billion. The next, we looked at a sort of a medium level program that added a child allowance to the work programs. And that cut child poverty by 35 to 40%, and cost $44.5 billion. And then we looked at 2 ways of actually reaching that 50% goal. They're much more expensive, $90 billion to $108 billion. And we did that 2 different ways. One, looking at expanding existing safety net programs along with work programs, and the other looking at a child allowance and other newer programs added to work-based programs. So you can see that both of these crossed the 50% reduction and still encouraged work significantly, but the price tag is much higher. I just want to say something. So in conclusion, individual policy programs are insufficient. Bundling them together can reduce child poverty and increase employment. And obviously the package costs range from 8.7 to 108.8 billion per year. But this should be put into the context that macroeconomic studies show that the costs of child poverty to the country are in the range of 100 billion to 1.1 trillion per year. So even the most expensive programs, if we look at the long range, should be doable for our country. There are a number of contextual factors that I'm not going to go into, but just to mention very briefly, obviously the stability and the predictability of the income is important. Many poor people really can't make their ends meet from one month to the other. Knowing that they're going to get money on a regular basis would be better rather than getting a big check once a year. Equitable and ready access to programs. As you know, many states now are trying to block people getting Medicaid. There are lots of bureaucratic barriers to families. We need to get rid of those barriers. Equitable treatment across racial and ethnic groups. We know that racial and ethnic groups such as African Americans have difficulty with jobs, employment, housing, segregation, and various other issues that impede their ability to use the programs we would give them. Equitable treatment by the criminal justice system. Same deal, basically. We know that many poor people, especially African Americans and Latinx, are much more highly represented in the prison population, and we know what that does to children as well as family income. Growing up in a poor neighborhood or a poor rural area has a multitude of problems that, again, impede these programs, and of course, health and well-being. So where to next? Is this all pie in the sky? We seem to be battling just to keep where we are today. What do we do with such a grand scheme? Firstly, a little north from us, the Canadians have already taken this on, and this in blue shows a comparison of a Canadian-style child benefit and compares it to our child tax credits. And our child allowance that we put into this report would mimic pretty much the Canadian-style child benefit. There's actually a month after our report came out. I'm not taking complete credit for this, but there was legislation put into Congress, both in the Senate and the House, called the American Family Act, which would create a child allowance similar to the one we recommended, and is estimated to reduce child poverty by 38% if it were to be passed. Now, we know it's not going to be passed now, but it could be part of a budget reconciliation, which only requires a bare majority in the Senate. So I want you to open your minds up and imagine. I know this sounds partisan, but that's who's supporting this. Imagine the next time the Democrats have a governing trifecta, House, Senate, and presidency. That could be 2021 or 2025. What's more, the expiration of the Trump tax bill in 225 will force a reconsideration of the entire tax code, and we could use that as an opportunity to push through a child poverty slashing provision when the deal comes out of that deadline. So I remain optimistic that we can actually do this. Although these are dark days in many ways, I think the light is on the horizon. And lastly, before I stop, I don't even have to read these. There's a lot we can be doing while we're waiting at the state and local level. There are earned income tax credits at the state and city level that we can be pushing through our chapters. I was having a conversation about that with folks from Arkansas just yesterday. We can work on affordable housing. A lot of the funding for childcare is local. There are child-friendly cities movements. The city of Pittsburgh is doing amazing things for children, as an example. And value-based payments in primary care are also something we can work on. So there's a lot for us to do while we're waiting, especially in the next year. And so if you want to learn more, I encourage you to go to the National Academy website. It's nap.edu, and either that sort of odd number or just reducing child poverty. That's National Academy Press. That's what the P is for. And you can download the full report. There's executive summaries. It's fascinating reading, all 487 pages. I would read like 100 pages a night, But actually, there's a good executive summary, and there's individual chapters that you might be interested in. So I'm going to end with my favorite quote from Frederick Douglass, which is, "It is easier to build strong children than to repair broken people." Thank you for listening.